Good morning, good afternoon, good evening to you guys. It's Friday today, Friday the 18th of September. I always have to check the date to remind myself the days are flying so quickly. Welcome to the last edition of the week, guys. We're taking a look at the global look at the pandemic. It's making a huge comeback. I did promise you guys on Wednesday that on Monday, I think it was, that we'll be taking this a bit more seriously. So guys, without further ado, let's get to today's show. I want to start today's with an update on where we are in terms of numbers across the world, across the globe. So my first video, so basically this is what's going on. The world numbers are rising. This is coming back big time. The UK is in crisis. We've got no leadership. We've got no plan. We've got no direction. In the US, it's even worse. You have a guy in the US who's flaunting his own laws, who's criticizing his own government's website, guidelines. Okay, so the world's in chaos on this. There is absolutely no leadership in the world on this matter. So guys, take a look at my first video, which is it's just a shambles. Take a look at the world's counts as it stands today.
Now, more than 30 million people around the world have now been infected with the coronavirus. That is triple the number of cases from just 12 weeks ago, according to Johns Hopkins University. The United States, India, and Brazil account for more than half of the world's cases. And as infections continue to rise, so does the death toll. So far, the virus has killed nearly 950,000 people.
Welcome back, guys. I mean, the Spanish flu took 675,000 in the US. They're approaching 200,000. So they're getting close to what the Spanish flu did to them 100 years ago. It took 50 million in the world. But let's remember this. When the Spanish flu happened, we had no antibiotics. We had no medication like we do today. We had no ventilators. We didn't have the medical equipment that we have today. So the pandemic ran riots 100 years ago. Do you know what stopped it 100 years ago? Distancing, social distancing, and masks. That's all they had, and that's all they used. And at some point, it stopped. Now imagine America lost 675,000 100 years ago. They're already approaching 200,000 now. In another day, they're going to be at 200,000. In another 3 months, if this goes on till December, with this fool in the White House, they're going to be seeing about 300,000 plus. How do you explain that 100 years ago, you had no ventilators, you had not even antibiotics, and you lost 675,000? And in today's modern times, you're losing half that number again. It's crazy, right? Let's go over to the UK, guys. The UK is not faring any better. UK has no direction, no leadership, no cohesiveness. Everything's a shambles. Parts are on lockdown, some are not. Then the lockdown's weird from this part to that part. It's just a shambles. So for those of you who want to know where the UK is at the moment, the status of our pandemic crisis, what areas are on lockdown, what areas are being looked at, take a look at the BBC's report, which I recorded yesterday morning.
Good morning. It's Thursday, the 17th of September. Our top story is stricter restrictions are going to be brought in parts of England and Wales. It's an attempt to halt the rise in coronavirus cases.
New measures for the northeast of England will be announced later today, while residents in parts of South Wales will face local lockdown from this evening. Greg Mackenzie has this report.
The northeast is set to become the latest area in England to come under local restrictions as coronavirus cases rise. The announcement is expected to come from the Health Secretary Matt Hancock later this morning. Areas including Newcastle, South Tyneside, Sunderland, Northumberland and County Durham have all seen a rise in new cases. Meanwhile, in the county of Rhondda Cynon in Wales, further restrictions will be put in place this evening, affecting around 240,000 people. Residents there won't be able to leave the county without a reasonable excuse, such as travel for work or school. Earlier this week, Newcastle City Council leader wrote to the government asking permission to impose new restrictions across the northeast region to prevent a full lockdown.
We're extremely concerned about the rise in COVID cases in the last week and even over the weekend. They're going up exponentially. We've got to get on top of this now in our region, because if we don't stop it spreading even further and more quickly, we'll end up in a catastrophic full lockdown.
The new measures are expected to include restrictions on households mixing and pubs being ordered to close earlier, in addition to public transport being reserved for essential travel only. Both areas will join a long list of places currently under tighter measures, and the government says it's constantly assessing infection rates across the country and will take measures if necessary.
Welcome back, guys. Now, let me scoot over to the US and an even more parallel universe situation. Seriously. We have a guy in the US right now, Trump, okay, had a rally yesterday. Now he's calling his rallies protests to get around his own government's laws. So in order so he can have a rally where people don't need PPEs and people don't need to social distance, just like in a protest, right? Even though protesters are being careful. His people don't believe in masks because he's taught them not to. So in order to have these people keep coming to his rallies and keep infecting each other and keep the crisis going and keep feeding the virus, he's now calling his rallies a protest. But that's not all. He is going on this podium and criticizing his own laws. Jesus Christ. No, seriously. This is, if it wasn't shocking, yeah. I mean, this is the sort of thing that you put in a White House comedy, you know, like if you do a film of some cuckoo president, but it's all in a script and it's just funny after crisis after crisis, after laugh after laugh. And it works because you know that's not real. However, this is real. This is real life. Can you imagine Churchill during the bombing of London, when people had to go in the underground to shelter from the bombs raining down on them? Why did he do that? To protect them, right? So in the nighttime, they turned off the lights, the street lights, so that the bombers couldn't see clearly. Wherever it helped, it helped. I'm sure they didn't have radar and all that. Sorry, they did have radar, but they didn't have infrared and all that at the time. So if you turn the lights off, they didn't see very well. So that worked. And then people went in the shelters, in the tube tunnels to shelter in the nighttime. Can you imagine Winston Churchill waking up one day making a speech and say, "We're tired of hiding in shelters. We are tired of hiding in tube stations at night. We want our freedom back." This is Churchill complaining about his own laws and guidelines put in to save his citizens. Take a look.
Allowed. So he's changing the name. That's his plan. And we'll contrast that with what Joe Biden said about that. Here you go.
By the way, officially, this is called a protest. You know that. We no longer call it rallies. We don't use the term rally, okay? Rachel knows. We don't call them rallies anymore because, you know, you're not allowed to have a political rally for more than 10 people. You're not allowed to go to church. You're not allowed to meet. You're not allowed to talk to anybody. You have to stay in a prison. Your home has become your prison.
I mean, the lack of leadership during this pandemic has cost so many lives, and sadly will cost many more, many more, because this thing's not going any place yet. The confusion on vaccines, people are going to die because they didn't take it. The confusion about masks, people are going to die because they're reinfecting others. The confusion about social distancing. There's a protest apparently tomorrow in London. People are going out to protest about their freedom. It's unbelievable. I mean, my next clip makes you wish that in the White House, we had a sane individual. Listen to Biden talk about the same thing that Trump has just spoken about. Take a look.
We should be careful across the board, but there is a big difference between people walking, moving along, and people sitting down, cheek to jowl, shoulder to shoulder, 1,000 of them, breathing on one another, indoors and out, that causes real serious problems.
Guys, I mean, if Biden's the person running against Trump, for those of you who don't know, if Biden or Obama or even idiot Bush, little Bush, younger Bush, yeah, who to me, in my lifetime, was the worst president before this guy, but he was a great guy compared to this guy that's in place now. Any one of those people would have been in power in this time, the world would have seen a different approach to this pandemic. But it's hard to tell idiots like some of the people who contact me on my thing. It's hard to even try and explain that to them because they think, no, it's all about now. We are the smart ones. You are being fooled by the government. We're the ones who know. You can't explain that to them. You can only hope that Biden wins and America still has a virus for the next 12 months. So that you can see the 12 months of Trump as opposed to the 12 months of Biden, a real human being. Guys, I'm going to go to my last video now. We've come to the end of the show, other than this video coming now. And this video is just to remind some of you, like those who are going out to protest tomorrow about lockdown and all of this, yeah? Lockdown hasn't killed anybody. Lockdown, yeah, people have suffered mental health distress and that sort of stuff. The lockdown was put in place to try and control something that man can't control, really. So we can only try and diminish its impact, is all we can do. Lockdown hasn't killed anyone. Not wearing masks or going to places without protection has killed many. Trump, who's out there talking and still having rallies and calling his rallies protests now. It's shocking to even try and imagine how many people have died that went to his rally and how many people have died those who went to his rallies passed the thing on to. We know of at least one, Herman Cain, that I told you about. Trump's own friend, rich black guy, ran for president, tweeted from a Trump rally. The rally that killed him, he tweeted from it, sitting in the chair saying, we love our freedom or something like that. He tweeted at the rally. Couple of days later, he got sick. 2 weeks down the road, he was dead from corona. Okay? And we know that the virus has killed those who didn't practice social distancing. However, what hasn't killed anybody is social distance hasn't killed no one. Wearing masks hasn't killed no one. Okay? I want to bring us back down to earth a little bit. This clip is from Venezuela, who's going through not just a pandemic, but imagine going through or being admitted to a hospital with no nurse and no medication, with water for I think it's 6 or 8 hours a day. That's it. 8 hours a day, water goes after 8 hours. When you see this video, it makes you appreciate that lockdown in your own home, in the comfort of your own home. And I don't think we're going to go into lockdown, but even if we did, it's not that bad. It really isn't. Take a look.
In the once oil-rich city of Maracaibo in Venezuela, COVID-19 comes hand in hand with fear and repression. This mother of three knows this all too well, so much so, she's still shaken by her experience.
Yo a veces me acuesto a dormir en las noches y me despierto pensando que estoy en el motel o que inmediatamente me aíslan. Desde allí no supe más de mi familia.
She says inside there was little food or water, and personal hygiene a luxury.
Dijeron que me iban a dar implementos de higiene personal. Me los dieron después de 15 días.
Away from family and unable to leave her room, she says she was held for 23 days despite never testing positive for the virus. Doctors tell us this motel is one of many being used by the Venezuelan government to house suspected COVID patients in a bid to keep them off Venezuela's crumbling hospitals, where the situation is similarly desperate. The main hospital here, one doctor tells me, has only 9 ICU beds, 6 hours of available water a day, intermittent power, and 1 X-ray machine that hasn't worked for months. Details that even healthcare workers aren't comfortable sharing because of a climate of fear. In this video from a hospital in Maracaibo shared on social media, patients protest at the shortage of medical staff. They plead for help.
Welcome back, guys. Come to the end of the week, the end of the shows for the week this week, guys. Thank you for spending your week with me. All of the views, all of you who have participated, all of you who have commented, we appreciate your comments. Keep them coming. Please do subscribe. We need more subscriptions. Get the message out there. If you've liked my video, if you've enjoyed this video, hit the subscribe right now. Guys, I'll see you all back on Monday for the 3 times a week show now, the new edition of the show. So guys, time to say my goodbyes now, and I'll see you all on Monday. Take care and all the best. Bye-bye.